So the minute a person says snoring, it indicates that there is a blockage somewhere in that air passage.
So you cannot be snoring even a single night. Like
No,
even if you're
ideally,
tired.
no. But again, so I was coming to that. What happens is, if you're snoring occasionally, so we know that post alcohol everybody will snore because the muscles start collapsing and the airway gets compromised. So if it's that occasional snoring, is fair enough. I mean, if it's happening maybe once a week or something like that, and it's not a regular basis, like you said, when you're very tired and you're exhausted and the muscles are completely relaxed, then it's fine. Then I don't think you need to worry so much. You keep a watch on it. But if you're a regular snorer, if you're a snorer on a day-to-day basis, or at least, and then again, in science, we have gradations of snoring.
Okay.
So there's like 1, 2, 3, 4
Levels of snoring.
levels of snoring. And a level floor snoring is what we call as heroic snoring. So heroic snoring is you're in a closed room, closed doors, closed windows, and somebody can hear you snoring outside the room. That is really heroic snoring, as we call it. So things like this, definitely you need to look into it. You can't overlook these things. But the occasional snorer here and there, occasional after alcohol, maybe you're extremely tired after a function, marriage functions lasting few days, and things like that, travel.
And this snoring is actually called sleep apnea.
No, snoring is a sign of sleep apnea.
Okay, this
Sleep apnea. So apnea basically means stopping of breathing, cessation of breathing where there's an oxygen fault. That's what the word apnea means. So sleep apnea is the basic disease. It is of two different kinds. So one is the obstructive sleep apnea, which is happening because you're having some obstruction somewhere in sleep causing the apnea. And there is something called as a central apnea. So somewhere over a period of time, like I said, the brain signals are getting affected, the brain is not functioning very well, or there is some neurological disorder which prevents the signals from the brain coming down to tell the patient to breathe. So they have a pause in their breathing. And then that's called central sleep apnea. Right? So
and that
these
could be dangerous.
Yes, both are equally
Both
dangerous.
are, yeah,
Both are
exactly.
equally dangerous. That's why we try to differentiate between the two.
Okay.
And as an ENT surgeon, so your first statement where you asked that primarily I'm an ENT surgeon.
Yeah.
But over a period of 2 decades, when I've gotten into this field, realizing the fact that who better than an ENT surgeon to deal with the upper airway? We are the people who deal with the upper airway.
Yeah.
So that's where the interest built up 2 decades back, and we've reached where we are today.